Hello all. Today we are going to discuss on the topic enterobiasis. So, enterobiasis is a very important topic regarding the exam point of view and also clinical point of view because it is a very common parasitic infestation of the childhood, mainly affects children, and it has been said that you had the infection as a child, you have it now, and you will again get it when you have a child. So it's that much common because people carry this parasite for many years due to auto-infective cycle. So it is a very common parasitic infestation. So the attentive. So the causative organism is an intestinal nematode called Enterobius vermicularis. It is a pinworm or a threadworm. It is also called pinworm or threadworm. Coming to the epidemiology, globally about 209 million people are affected. So that much people are affected. This is only the data. Many people are infected and that is not included in the data. So it is very common, and most common age group is school going children, uh, and it is much common due to many people carry this parasite in their intestine due to auto-infective cycle. So what are the factors promoting the infection? It is poor hygiene and overcrowding, impaired hygiene, and poor personal care like nail biting, negligent hand washing, etc. So what happens is that actually this disease mainly causes a condition perianal itching. So this is the buttocks and this is the anus, and it causes perianal itching mostly at the night time. So when the children scratches this uh, pruritic region, the uh, egg comes in contact with the hands of the children, and when they through the hands, that egg can again reach mouth and get auto infected to the children, and from the hands of the children the parasites, the eggs can also reach to their parents. So parents of those childs can also get the uh, Enterobius vermicularis infective egg. So while treating the enterobiasis, we need to treat the whole family of that child. Okay, so coming to the life cycle, it has only one host, that is humans, and infective stage is embryonated eggs. Embryonated eggs. So the life cycle is that embryonated egg, when ingested, it hatches to form larvae in the intestine, and this larvae penetrates and develop in the mucosa of the intestine, large intestine, and develops into adult worm in the lumen of the cecum, and the adult female migrates to the perianal skin and causes perianal pruritus. It is the cardinal symptom of this disease. Causes perianal pruritus, and this female adult female migrates to the perianal skin and lays egg on the perianal fold, and the diagnostic form is the X on the perianal fold, and these eggs can cause auto-infection by retrograde infection, by which the egg again develops into adult adult worm, and then that adult worm migrates into the lumen of the cecum, uh, or migrates into the rectum, and also the eggs can also be again or ingested by auto-infection by the uh, itching. The eggs can reach into the hands of the child, and then that embryonated egg will again be ingested, and these eggs can also be found on the clothes like undergarments, bed sheets, etc. And the coming to the pathogenesis and clinical features, most of the people are asymptomatic, and females, children, young adults, they are often symptomatic than males and older adults. So cardinal symptoms are perianal pruritus, and it is often worst at night time due to nocturnal migration of female worm. And uh, due to the perianal pruritus uh, and repeated scratching, excoriation of the perianal skin can occur, and also bacterial superinfection. Okay, so due to itching, the minor injury can occur on the skin, and that can again lead to superimposed bacterial infection, and also that can contaminate the fingers, that can lead to auto infection. Another symptom is abdominal pain and weight loss, which occurs in heavy infection. Next symptom is due to migration of worm, vulvovaginitis can occur. Due to migration of worm into the vulva, that can lead to vulvovaginitis, can lead to granulomas or of pelvis and peritoneum. And migration of worm can lead to involvement of urinary tract, peritoneal cavity, lungs, and also liver. Now coming to the lab diagnosis, the microscopy of perianal skin sample is the test of choice, and that detects the eggs which are plano convex. So microscopy of the skin of the perianal region. So I already told you perianal migration of the adult worms, and adult worms lay eggs there, and the sample of this skin is taken and examined under microscopy. And how is this specimen collected? Is by cellophane tape or by NIH swab. NIH means National Institute of Health, USA. Cellophane tape, it is applied on the skin. A tape, it is a tape. It is applied on the skin, and this tape is then mounted on clear slide with a drop of saline, and then NIH swab can also be used. NIH swab is it contains a glass rod with cellophane part rolled over. It is with cellophane part, and they are connected by a rubber band, and this cellophane part is rolled over the perianal skin. And while collecting a specimen, 4 to 6 constitutive tapes are needed, and timing most preferred is late evening, because more egg deposition occurs at late evening. And coming to the final treatment can be either of these three. It includes mebendazole 100 mg can be given once, or albendazole 400 mg once can be given. This is the most popular one, we all know. And pyrandyl palmoate 11 mg per kg once can also be given. Any one of these three can be given: mebendazole, albendazole, pyrandyl palmoate. And important note is that same treatment should be repeated after 2 weeks, and also because like if we give this albendazole 400 mg once, that will kill the parasites that those are in our rectum or cecum. But if the if our hands or the contaminated clothes, the parasites, the eggs on the in our nails, contaminated clothes are not died. So in order to prevent reinfection by auto infection, we the treatment should be repeated after 2 weeks. And treatment of household members is also advocated to remove asymptomatic surveys of potential reinfection. So all members of the household should be treated at the same time, and that is important. This is an important point. And for prevention is actually not realistic because transmission is very common, and even if we say about prevention, that's very difficult uh, to attain prevention of this, and prevention includes proper cleaning of bedclothes, keeping nails short, and frequent hand washing. That is, improved overall personal hygiene is the only thing for prevention. So that's it about enterobiasis. Uh, what all you need to remember is that it is caused by intestinal nematode Enterobias vermicularis, and main feature it causes is perianal itching, and it also it is very it is very common due to auto infection, and all members of the family should be treated uh, simultaneously, and treatment should be repeated after 2 weeks. So this much you need to remember. And infective form is embryonated egg. Okay, thank you.